Hey everyone, welcome back. So today's video is going to be one of a few I'm going to do on basically injuries to the growth plate in growing teens. This is something that I'm increasingly seeing among my clients, and I think because there are more and more teens entering sports at an earlier age, while their bones are still developing, I think this is why, we're sort of seeing more of this. So today I'm going to be talking about Osgood Schlatters Disease. I'm also in the very near future going to be doing a couple of other growth plate injuries. So I'm going to be doing one about Sever's disease, and I'm also going to do one on little leaguer's elbow. Osgood Schlatters disease, it's an overuse injury which occurs during pubertal growth spurts in adolescence, and it basically causes these sort of painful bony lumps just below the knee at the top of the shin bone. Okay, so in this picture, just in that circle there, you can see the sort of bony lump that we're talking about that is characteristic of Osgood Schlatters. And as I've said, this bony lump basically occurs due to inflammation of the growth plate at the upper end of the shin bone, and this basically is a weaker part of the bone that is sort of much more vulnerable during these growth spurts in adolescence. And because the bone in this growth plate is basically it's not sort of fully undergone ossification yet, so it's still like a cartilage. So this makes it much more weaker than the rest of the bone, and that's why it is so vulnerable to injury. Now, as I've said, this is an issue with the growth plate that happens during these growth spurts in adolescence. So usually by the time puberty is over and the bones stop growing, so we're usually talking between sort of 14, 15 years old and 18 years old. Usually at this point the problems are then resolved, and there won't be too much of an issue. Now, despite the fact that Osgood Schlatters disease was originally thought to affect more boys than girls, this has actually now changed, and I think this is because besides the fact that children in general are participating in sport and also competitive sport at a much earlier age, certainly girls now as well are taking part in sports much earlier on. So this is why we're sort of starting to see this issue in more girls now. Now there are various risk factors that affect sort of how likely a child is to develop Osgood Schlatters. Certainly, as we've mentioned, age is a big one. It occurs during these pubertal growth spurts. For boys, we're usually looking at sort of between sort of 12 and 14 years old, and for girls, obviously we know that they tend to go through puberty a little bit earlier, so we're looking at ages sort of 10 to 13. Gender, as we've said, we are seeing an increasing number of cases in girls, but it probably is still a little bit more common in boys. The type of sport that a child is playing, so it's certainly more common in sports that involve a lot of running, jumping, sudden changes in direction, so things like football, basketball, and also ice skating and ballet. a child's flexibility, just as with any other sports injury. You know, tight quadriceps muscles can increase the pull on that patella tendon, and that in turn will pull on the growth plate at the top of the shin bone. So that's certainly a factor as well. So as we've just said, you know, if the quadriceps muscle, this one that runs up the front of the thigh, if that's tight, then that is going to pull on the patella tendon that runs from the kneecap, and if there's a pull on that tendon up where this muscle is shortening, so that shortens, then pulls this tendon up, that is then going to pull on the growth plate here at the top of that tibia or the shin bone. And so that's then where you're going to see, due to that pull, you're going to see inflammation here around that growth plate. Now, this is really caused by the fact that the bones, the muscles, the tendons, they all grow at different rates when a child has these growth spurts. And so this is what can potentially cause that patella tendon, which connects the shin bone to the kneecap, to pull on the growth plate at the top of that shin bone. Now, if there's repeated pulling during sports, this is then, as we said, going to cause inflammation of that growth plate. A tight quadriceps muscle in the thigh can further pull on the patella tendon, making the problem even worse. So if you're seeing if your client getting a massage for Osgood Schlatters, certainly some work on those quad muscles should be done, you know, to try and stretch that muscle out and sort of avoid that pulling. When the body forms new bone in an attempt to kind of close the gap in the growth plate, this can then cause a bony lump to develop, which is what we saw in that initial picture. And it develops just under the kneecap, at the front of the upper shin bone. And if we look at this x-ray here, we can see in this circle here, so this is the front of the knee, this is the thigh bone, and then this is the shin bone or the tibia, and you can see, so you've got the growth plate across here, and you can see that little lump which sits just below the kneecap. You can see this lump of bone that we're talking about that's caused by that sort of inflammation. And so that's the little lump that we saw on that first picture that I showed you, and that is sort of the best sign of Osgood Schlatters that you're likely to see in a client. And so with regards to symptoms of Osgood Schlatters, obviously, you know, we've sort of just mentioned that visible bump. Certainly pain and inflammation just under the kneecap. The pain usually worsens during activity, during running, walking uphill, kneeling, jumping, anything that sort of increases the force through that knee joint. But it will usually improve with rest. Usually Osgood Schlatters will occur just in one knee, but it can certainly occur bilaterally. And the pain will really, it tends to continue until that growth spurt stops. And, you know, as we've said, once the child has gone through puberty, the symptoms usually resolve by themselves. Now there are complications that can arise. So, you know, if the pain is becoming chronic and interfering, you know, with daily activities, or if the knee is noticeably red and swollen, if it locks or it's unstable and gives way, you know, you really want to be seeking medical attention. In rare cases, the growth plate may be pulled away from the shin bone, but that is rare. And even after, you know, when puberty is finished and, you know, symptoms subside, even then, that bony lump under the kneecap may well, you know, remain. But the pain should certainly go. So, in terms of treatments, pretty similar really to any other sports injury. You know, using an ice pack for 15 minutes every couple of hours just to help ease that inflammation. Anti-inflammatories, obviously, for the pain, so something like ibuprofen or naproxen. But just be aware of, you know, if you're asthmatic or if there are any sort of gastric problems, to be wary of taking ibuprofen. If the pain sort of during sport, if that's enough that it's causing a limp, then certainly, you know, rest is required for a couple of days. Physical therapy to maintain muscle strength and flexibility in the leg certainly may help. Now, whether that's seeing a physiotherapist or a massage therapist, but certainly, as we've said, sort of stretching out those quad muscles as well to avoid further pull on that patellar tendon. You know, and in severe cases, it is possible that a complete break from sport may be required. You know, as with many of these sports injuries, you know, as much as people don't want to do that, sometimes that's sort of in the long run, that's the best option. You know, because sometimes if you just kind of push through it, it just makes the injury worse, and then you'll end up spending longer out of the sport. So, you know, you really need to kind of listen to your own body. So there are preventive measures, you know, that you can take to either sort of try and prevent it in the first place, or to, you know, once, if you already have Osgood Schlatters, these can still be used to just help to reduce those symptoms. So this is things like, obviously we've mentioned ice packs for 15 minutes every couple of hours or after sports, just to kind of ease that inflammation. You can also use heat packs on the knee for 15 minutes before sport, and that's to just really relax all that surrounding musculature. And also it, you know, should help just sort of ease the pain a little bit as well. And certainly you can alternate heat packs and ice packs as well in between. Stretching before and after sports, it sounds obvious, you know, but too many people still don't do it. And certainly, you know, quad stretches really are the big one to focus on. Wearing supportive footwear, wearing shock absorbing insoles to reduce the impact through that, through the shin bone and through the knee. So wearing those in certainly sports shoes, you know, may be quite helpful. And also, I mean, depending on the sport, you know, possibly wearing protective knee pads as well may help. So with regards to massage treatment, you know, there are a few benefits. Obviously, as we know, it increases circulation. So, you know, just helping with the blood flow through that knee joint, and relaxing the quad muscle, as we've mentioned, you know, because if that's tight, it can pull on that patellar tendon, making the inflammation around the growth plate worse. But also working on the IT band, because we know that, you know, you may have read my post on IT band syndrome. If the IT band, you know, is naturally quite tight anyway, but if it is particularly tight, that again can pull on the lateral side of the knee, causing a lot of inflammation and pain as well. So in massage therapy, you'd want to be working on that. And also with consent, obviously because of the age, you know, working on the glutes, and also on the gastrocnemius muscle and the soleus in the calf can also help just sort of ease off the pressure from that around that knee joint. And also passive stretching of the quads. You know, if you see a massage therapist who is also, you know, sort of works as a sports therapist as well, they can do some passive stretching of the quads and the IT band as well. And again, that's just to kind of relax all that musculature, you know, and try and sort of reduce the amount of inflammation, you know, that's occurring around the knee. So yeah, that's in a nutshell, that is Osgood Schlatters. And as I say, we'll be doing some other growth plate related injuries, such as little leaguer's elbow and also Schlatters disease. So do keep an eye out for those as well. But do feel free to comment down below, or subscribe to my channel. There's lots of other videos up already on various sports injuries and medical issues and how massage can help. So do take a look at those. You know, you can comment below, or you can contact me if you have any queries or questions through my Facebook page or Instagram. I'm on there as the Medical Massage Lady, or you can email me at sam@medicalmassagelady.com. I will also have my 2 websites up and running very, very soon. I feel like I've been saying that for months now, but they will be up soon. Yeah, I will come back to you. So keep an eye out for more videos to come. And for now, that's really it from me. So take care and see you next time.